The opioid epidemic ravaging parts of our country, and that is still far from over. It continues to be an extremely complex public health crisis, gripping communities in literally every corner of our country. The CDC estimates that nearly 500,000 people died from opioid overdose over the span of 2 decades, beginning back in 1990. In partnership with the civic engagement company, A Starting Point, lawmakers weigh in on what more needs to be done to save lives.
This is going to be a whole of government, whole of society effort to turn this aircraft carrier problem around.
5 people an hour in this country die from heroin overdose. Think about that, 5 an hour. That is an epidemic, and we got to treat it as such.
Most of all, we have to understand that addiction is a disease, and we have to treat it like that.
The opioids have touched every part of America. There's no suburb too wealthy, no town too small not to face it. And we have awakened to the reality. Just say no isn't good enough. Addiction is a disease. We need people to treat the folks with the diseases to make sure that they have a chance to overcome this addiction. And of course, we need to stop the flow of drugs in every way possible into this country.
There's a $4 billion bill called the Comprehensive Addiction Recovery Act, and it is a compendium of funding sources for treatment, prevention, and law enforcement. And it gives funding to law enforcement and funding to counseling and all the other things, the treatment you can provide. Nowhere near enough, but it is a start.
There's no doubt that we need more treatment dollars for the opioid addiction, and I support the federal government putting up billions more than we have. But I've spent enough time with addicts to understand that if we're not focused on prevention first, we're going to be constantly losing this fight. So here's one way we can focus on prevention. Have the federal government require insurance companies to pay for more pain treatments that aren't pills and opioids. If insurance companies made it easier on you to treat your pain through, chiropractic or physical therapy or acupuncture, then physicians wouldn't be driven to recommend and prescribe so many of these pills.
I think the best thing to recognize about the opioid crisis is you can't solve it in D.C. It absolutely has to be solved at the local level. This is your mayors, the local police officers, your local faith-based charities, your local human services centers. And so what the federal government can do is target resources in the most efficient way possible.
We have to recognize that the opioid crisis is not a criminal justice issue. We can't put people away in jail. It is a health issue, and we need to treat it like that. We need to have professionals in our communities who know how to treat opioid disease. We need resources for our communities so that they have the facilities. So if you call up and say, I need some place to go, or someone I love needs a place to go, they aren't told there's nowhere for them to be. We need to look at those people who are impacted outside the person who has an addiction, their parents, their kids, friends, relatives, teachers. Our hospitals and our physicians need the kind of support to be able to help people.
You just can't say, I'm just going to quit. It has that powerful effect. So how do we treat it? Well, first of all, we get away from that stigma that the person did this to themselves. It was an act, and they can turn. That stigma has to be addressed and disposed of.
This is not a character flaw. So many people feel stigmatized and shamed by this. And I'm telling you, a lot of them, all they did was follow the advice of a trusted clinician. They started taking this pain medication. They took too much of it because they were told to. And they became addicted. The more we can do to make clear to folks that it's okay to seek treatment and it's okay to relapse, because we'll help you get back on your feet and help you get through it again, the better off we're going to be.
And thanks to our partners at A Starting Point who helped put that segment together. You can hear more from lawmakers on tactics to combat the opioid epidemic on their website, astartingpoint.com.